Federal government has announced that over 61.5 million Nigerians, mostly children, have received vaccines against various infectious diseases from October 2023 till date. The Association of Medical Laboratory Scientists of Nigeria, the AMLSN, has urged the federal government to give equal opportunity to all health workers across the country. Good day, viewers. Welcome to DDM News Update on Pulse. On our program, your home, your world. I often remind you guys to subscribe to our YouTube channel in order to get the latest on health. The federal government has announced that over 61.5 million Nigerians, mostly children, have received vaccines against various infectious diseases from October 2023 till date. This was disclosed on Tuesday by the Executive Director of the National Primary Healthcare Development Agency, that is the NPHCDA, Dr. Muyi, during a press briefing in Abuja. The event focused on the 2025 African Vaccination Week, themed "Immunization for All is Humanly Possible." Dr. Ina said the vaccinations covered measles, yellow fever, human papillomavirus, malaria, and mpox. He noted that these vaccines were administered as part of ongoing national health campaigns and immunization outreach. The NPHCDA board said the agency has mapped nearly 54,000 settlements nationwide. We use our polio campaign as a pilot. Out of 126,007 under 5 children listed, 851,929 were vaccinated, he said. According to him, this approach will now be scaled across campaigns to reduce the number of zero-dose children in the country. Our vision is to leave no child unimmunized. We are addressing routine immunization gaps using this data-driven strategy in our state. He stated that vaccine delivery has been scaled to 6 northern states: Kano, Bauchi, Sokoto, Kaduna, Borno, and Yobe. These efforts, he said, are in collaboration with states and security agencies to reach people in hard-to-reach areas. To enhance vaccine security, Ina said the government is investing in cold chain equipment. He disclosed that the Lagos cold storage hub has been completed and work has started on the Kano hub. Both facilities will support the Abuja hub, which is already equipped with UNICEF-backed cold rooms. In addition, 1,653 solar-powered refrigerators are being procured in collaboration with Gavi and UNICEF. He revealed that. Wonderful. The agency also achieved major success in 2024 with measles and yellow fever campaigns. We vaccinated 25.9 million children for measles across 26 states, representing 98% coverage. In our set. Wonderful. Also, 22.5 million children were vaccinated against yellow fever in Lagos, Yobe, and Borno, achieving 94.6% coverage, he added. Dr. Ina announced that Nigeria has introduced 3 new vaccines: HPV, malaria, that is the R21, and mpox. The HPV vaccine was introduced in October 2023 and expanded in May 2024. Over 30 million adolescent girls between 9 and 14 years have been vaccinated against HPV across the 36 states and the FCT. The HPV vaccine has been integrated into the National Routine Immunization Schedule and is free in all PHC facilities, that is the Peer Health Centers. This is a huge milestone in the fight against cervical cancer. The vaccine is 99% effectively. In 2024, Nigeria also began administration of malaria vaccine in Kebbi and Bayelsa states. We received about 1 million doses and vaccinated 1,158 children. He added that the malaria vaccine has been included in routine immunization programs in those states. Mpox vaccination was introduced in 7 states, targeting immunocompromised persons and frontline health workers. A total of 4,306 persons have been vaccinated so far against mpox. Looking forward, Dr. Ina announced that the next round of polio campaigns will begin April 26 in northern states. Southern states will follow on May 3rd. However, Nigeria has recorded 17 cases of circulating vaccine-derived poliovirus type 2 in 2025 across 8 states. 12 cases were identified through acute placid paralysis surveillance and 5 through environmental samples. Ina explained. He stressed that efforts are ongoing to improve team selection, supervision, and accountability in the polio campaign. Also speaking at the event, WHO country representative Dr. Weta Molumbo, represented by Dr. Eshituwase, said vaccines save millions of lives. He noted that 158 million lives have been saved globally through vaccines over the past 50 years. Vaccination accounts for 40% of the improvements in infant survival globally, he said. He called for more investment in immunization, especially for children who have never received a single dose. So please, try it if you have not received a single dose for your child. UNICEF's Nigeria representative, Kristen Waldred, said immunization remains Nigeria's best public health investment. She said about 8 million children are born in Nigeria every year, making immunization critical to national health. She hailed Nigerian success in eradicating wild polio in 2020 as proof of what is achievable with strong political will. Molde said Nigeria has made strides in tackling vaccine-preventable diseases, including COVID-19 and meningitis. However, she noted that challenges remain, particularly in reaching every child. But we must continue to prioritize immunization, or don't you think so? Vaccine prevents diseases and saves lives, so we have to.
Good morning and greetings from Abuja, Nigeria. My name is Dr. Muyi Aina and I am the Executive Director of the National Primary Healthcare Development Agency in Nigeria. In my role, I run the organization that is responsible for delivery, coordination and delivery of primary healthcare to Nigerians, which is inclusive of immunization and especially both routine immunization and campaigns. I bring greetings from the minister and it's really a pleasure to be here today. On behalf of the government of Nigeria, I'd like to really just express our thanks to the leadership of the collaborative action strategy, not just for the engagement and the support that we have had since we kicked off last year, but also for the learnings that is coming our way from the collaboration. I speak for myself. I'm the co-chair, as the co-chair, Dr. Ntadom, who's the Director of Public Health at the Federal Ministry of Health and Social Welfare, and the Coordinating Minister for Health as well, Professor Mohammed Ali Pate. I recognize the HCE leadership team for the invaluable technical guidance that you're giving us, but also for steering the country level strategies. I think a lot of the adoption of the framework has guided what we are doing to try to improve the quality and outcomes of our campaigns in Nigeria. Since we kicked off the CAS in Nigeria, we have done a number of things. One notable one is a workshop that we did to bring all of our campaign stakeholders together to really understand what are the bottlenecks and come up with specific reforms that will improve the quality of all health campaigns in Nigeria. And we landed on things around accountability across board for the government at all different levels, the federal, the state, and the local government levels, but also for our partners as well who are implementing this, as well as the donors and those are partners that are responsible for commodities and supplies, just to make sure that we're all working in sync. We looked at reforming the way we select our vaccinators to make sure they are qualified people, they can be well trained, and they can be held accountable for the quality and integrity of the activities that they implement. We also looked at our advocacy and communications, and what we landed on was the need to have tailored, community-driven approaches that speaks to the specific barriers within the different communities. Nigeria remains firmly committed to the cause, and we align with it because it's very much in sync with our country's health campaign strategy and vision and the direction that we're going. So the priorities that MPHCDA and our other health MDAs institutions are focusing on really reflect this. Before I close, I'd like to thank His Excellency the Honorable Minister of State for Health in Ethiopia, who's also our pilot country, for the collaboration and the cross learning, and look forward to pushing forward with the learnings from this webinar through the technical working group that we have established in Nigeria. Thank you.
The Association of Medical Laboratory Scientists of Nigeria, the AMLSN, has urged the federal government to give equal opportunity to all health workers across the country. The body also tasked the government to treat every profession in the sector with fairness and justice to ensure better service delivery in Nigeria. National President of AMLSN, Dr. Uche Odonyema, made the call in Owerri, the Imo State capital, during the 2025 World Biomedical Laboratory Science Day. He emphasized the need of improved funding of medical laboratory services to make test results more reliable, affordable, and accessible to ordinary Nigerians. Dr. Odonyema also appealed to President Bola Ahmed Tinubu to ensure the full implementation of the National Health Act 2014. He maintained that the Act, if implemented, would promote quality health service and proper coordination in Nigeria's health system. He said, "We urge Mr. President to remember the National Health Act 2014 and ensure it is implemented to benefit all citizens." Odonyema called on the federal government to increase the health sector's budgetary allocation, stating that the current funding level was inadequate to meet the growing needs of Nigerians. He said basic health care provision must be given priority if Nigeria must meet universal health coverage goals. Wonderful. The government must fully implement the approved scheme of service for medical laboratory personnel at federal, state, and local government levels, he said. He warned against rising quackery in the profession and the unchecked spread of unregulated health training institutions across the country. He also decried the poor regulation of in vitro diagnostics, which, according to him, poses a danger to public health. The MLSN president called for urgent constitution and inauguration of the association governing board, which he said would strengthen professionalism and regulatory capacity. He further demanded the liberalization of the headship and restructuring of the Federal Ministry of Health. According to him, such reforms will help appoint credible and unbiased health administrators. He said these administrators must be professionals with the capacity to create an enabling environment for utilization of resources. He concluded that all professionals are fairly treated. Nigeria's healthcare delivery would witness improvements in both quality and coverage. So please, the government should take note. Finally, the State Ministry of Health has on Tuesday, April 22nd, 2024, confirmed a measles break in Rukubi, Doma local government area of the state. The health officials made this known during a stakeholder sensitization meeting held in Lafia, with council chairmen and their spouses in attendance. The outbreaks comes ahead of the state's planned launch of the rubella measles vaccination campaign, slated for October. They disclosed that the disease now threatens children aged 0 to 15 months in affected communities. Governor Abdullahi Sule said that the state would not relent in fighting measles and rubella infections across all local councils. Deputy Governor Dr. Emmanuel Akin, who represented the governor, highlighted the danger of ignoring measles symptoms in children. Please don't ignore that. According to him, measles and rubella often results in severe health complications, including blindness and death if not treated early. Confirmed. He said, "In my practices as a doctor, I have seen rubella leave many children blind. The disease is real and dangerous." The Sake noted that the federal government's vaccine initiative reflects a strong national commitment to child health and survival. He added that Nasarawa would integrate the rubella vaccine into its routine immunization programs. Meanwhile, Health Commissioner Dr. Gaza Gwamba confirmed the outbreak in several Doma communities. He stated that health workers who have been deployed to contain the virus and manage affected patients immediately. Good job. Also speaking, Dr. Usman Iskilo, Executive Secretary of the State's Primary Health Care Agency, commended the governor's support. He said Governor Sule's endorsement of the vaccine program proves his concern for children's health across Nasarawa. Wonderful. Dr. Iskilo explained that the combined measles rubella vaccine process against deafness, blindness, brain damage, and heart defeats. He expressed his stress that need for strong government and community backing to ensure the vaccine success in the October rollout. Stakeholders pledged support for the initiative, vowing to raise awareness and mobilize parents to participate fully in the campaign. Please, parents, don't hesitate to participate. Well, friends and well-wishers, this will be all on your health and wealth. Always remember that your health is your wealth. Remember that the state health authorities has urged parents to take advantage of the upcoming vaccination drive to protect their children's future. So please, don't hesitate to do that. Well, don't be sure to click on the like button, share, comments, and subscribe to our YouTube channel, Diaspora Digital Media, to get the latest for your health. I remain in Nigerian Michael Inezinin. Thanks for watching and do have a wonderful, beautiful day ahead. Bye for now until I meet your way next time.